Hello everyone, I'm Dr. Stanley Myers, and in this video I'm going to give you an introduction to what is HIFU, or High Intensity Focused Ultrasound. But first we have to do the legal disclaimer. The medical information supplied within these videos and my websites are for education only. The information is not intended to be used as personal medical advice. This is best obtained from your doctor after a full medical evaluation. So what is HIFU? HIFU stands for High Intensity Focused Ultrasound. In the medical field, we use low-intensity, non-focused ultrasound to perform body imaging such as abdominal and OB ultrasounds. When we look at ultrasound probes used in body imaging, the ultrasound waves go away from the probe in a linear or a divergent fashion, and they're low energy. In contrast, HIFU generates high-intensity ultrasound waves, and these waves are focused onto a very small focal area. A good analogy for this is a magnifying glass and how it focuses the rays of the sun in a small area to create an intense amount of heat. And if you don't get that focus right on the object you're trying to heat, it really doesn't do anything to it. It doesn't cause any harm, doesn't generate any heat, but if it's right in the focal area, it can actually light things on fire. And this is a picture of a piece of liver that's been heated with the HIFU technology and then sliced away so you can see what happened. And as you can tell, the area that's in the focal length of the HIFU energy completely gets blanched, or if you will, cooked, which destroys the tissue. And the diagram below, the pinkish diagram below that, shows that there's a rapid and irreversible cellular death in a very focal area. This allows us to generate heat very precisely, which is very important when you're trying to avoid damage to other structures within and around the prostate. And this image shows us what the transducer of the Sonoblate 500 system looks like. It has a robotically driven ultrasound head that moves forward and backward and can move side to side. It generates heat in a cone-like, from a cone-like pattern, and that ultrasound energy is focused into the focal point, and again we can use that to precisely lay in exactly where we want tissue destruction. And here we see an artist's rendering of how the HIFU machine delivers its energy into the prostate. It delivers it in a linear pattern going from the lower part of the prostate up toward the bladder part of the prostate. And then we program the probe and tell it exactly where we want treatment to occur. And so this is how it looks when we're in the operating room. Right now we have an image of the prostate. The prostate outline is approximately right here. We kind of go up and around this way. And we have a treatment, a linear treatment range. And these areas, these hash marks indicate areas that have been treated. This one is in the process of being treated, and here's where the rest of the treatments are going to go as it goes through. And it hits each one of these for about 3 seconds, takes a 3-second or a 6-second break, hits the next one. It keeps going through and it heats that tissue until it's all destroyed. And if you're wondering what the device looks like, here is a picture of the device that we have here in Portland. It consists of a console, which is basically a computer that drives the probe, and it also has a chiller that chills the rectal wall when we're heating the prostate to help prevent damage to the rectal wall. So that's a brief introduction on what is HIFU. In other videos we'll talk more directly about how we use HIFU to treat prostate cancer. We'll talk about who's a candidate and who's not a candidate. We'll also talk about the success rates with HIFU and what are the advantages of HIFU over other technologies. And thank you for your attention, everyone, and be well.